Good afternoon. Oh, good afternoon. We're all on the right side here. Welcome to the Helen Westberg lecture. This is the lecture that we honor the woman behind the man. And I was talking to John for a few minutes, just a few minutes ago, and I can reflect a little bit of those on my own family because my mom, followed in my dad's footsteps. My mom did what, when my dad got a job somewhere, she moved there. It wasn't quite the same for my mom as it was for John and Jill's, and they moved like 15 times. I can't imagine. But, in this day and age, there's always the person behind the person, and it's wonderful to be able to honor Helen Westberg at this time with such a wonderful speaker today. Well, my name is Butch Odom. I'm the Director of Behavioral Health for the Church Health Center. That's a new title from the last time I spoke to y'all, but I've had it for about 4 weeks. It's feeling okay. My emphasis over the next year or so, particularly as it relates to the city of Memphis, is to try and figure out how we can mobilize churches in this city around issues of addiction and recovery. Yesterday, I was sitting down here in my little United Church of Christ focused denominational luncheon, and I gave them my name and my title, and immediately people in my own denomination started talking about the resources in my own denomination that I wasn't aware of. And so I would just say that if you have a particular resource around addiction or recovery that's working in your faith tradition, in your community, come see me, let me know, because part of what I'm doing right now is just compiling everything that I can think of, or everything that I can get my hands on. You can also find me on the website. Just click my wherever I am on the website for churchhealthcenter.org, you can find my email address there, but I'd love to get the best practices in as many denominations as possible to fill out our work, both here in Memphis, but as you know, what we do now is we put all of our information on the web and make it available to y'all, make it available to the world. So thank you very much. This will be my second time to hear William Cope Moyers speak. He spoke at a clergy conference that we had, so he came and talked to about 250 pastors in Memphis a few years ago. And so we're really fortunate that he was willing to come back and talk to all of y'all. William serves as the Vice President of Public Affairs and Community Relations at Hazelden. But he's one of those brave souls who uses his own story to make the world a healthier place. His memoir, Broken, became a New York Times bestseller. He's authored a guided journal for those who are in the early stages of recovery. And his latest book is Now What? An Insider's Guide to Addiction and Recovery. And we moved his book signing from 1:30 to 2. So after his lecture, he'll be signing copies of his book between 1:30 and 2. It is my honor to introduce to you a special man, a friend of the Church Health Center, William Cope Moyers.
Good afternoon. Good, you're still awake. I learned a long time ago that the only thing more difficult than speaking to an audience after dinner is speaking to an audience after lunch. And so before we go any further, I'm going to ask that everybody, even you who are eating your apple there in the front row, stand up real quick, stand up and just stretch, and, keep chewing and stretch. Well, you guys are very good at this. And then take $1 out of your pocket and pass it up to the front of the room. You guys are easy. And now you can sit back down. Good. Now I know you're going to stay awake for the next hour. You better. And I know there's a couple of you sitting in the back there at the back table instead of sitting up here in the front row of the expensive seats, but you can't leave either. Butch, you're right. I was here a couple of years ago and I spoke to 250 pastors. I've been warned that they were a piece of cake compared to 250 or so nurses and other practitioners. And there's kind of the rebellious bunch over there, I can see. I'm glad you're sitting over there by the door because you can keep people from leaving, particularly you, the third one on the right there who keep raising. Yeah, don't let anybody leave. Thank you for being here. In my 17 years at the Hazelden Foundation, based in Minnesota where I work, I have given thousands of talks. I've spoken to Rotary clubs in the Diamond District of Midtown Manhattan, to a Rotary club in Moline, Illinois, the home of John Deere tractors. Wow. Are you from Moline? Good. That's the first time that's ever happened. In my 17 years, I've given talks at chambers of commerce in Salt Lake City. Really? To a chamber of commerce in Oklahoma City. Wow. I've given talks at national conventions of HR professionals. To conferences for doctors and treatment providers and nurses. I've given talks at government agencies like the National Institutes of Drug Abuse and the Centers for Disease Control in Atlanta. Wow, you guys are awake. I've given talks to faith-based treatment programs in the Texas Hill Country, to a homeless shelter in Hartford, Connecticut. I've given a talk at a synagogue in New Orleans, to an ornate Catholic cathedral in Minneapolis, to a one-room, wood-framed Baptist church on the other side of the volunteer state. I've spoken and carried my message of addiction and redemption to corner offices and boardrooms of Fortune 100 and Fortune 500 companies. Nah, not in this group. Are you kidding? I've spoken at institutes of higher learning like the School of Social Work at Emory University, medical students at the University of Minnesota in my hometown, researchers at the Massachusetts Institute of Technology. I've testified in state legislatures from Denver to Austin, Texas, to Sacramento, California. I've been in Congress to testify. I've been with President Bush in the White House. I've carried my message on Oprah, Larry King, and Good Morning America, and also on National Public Radio. In other words, I've been a lot of places and I've done a lot of talking. But today with you, not only is this an unprecedented moment, it's unprecedented for two reasons. Why? Because never before have I been invited to speak for a second time so quickly in the same city where I spoke the first time. It was less than 2 years ago that I was here in Memphis at the invitation of Dr. Scott Moyers and my dear friend Brad Martin, who could not be here today. It was 2 years ago that I was asked to speak to this clergy conference here, organized by the Church Health Center, to share my perspectives. And that's not often that I get invited to come back so quickly. But this is also an unprecedented moment for me, too, because I've never followed in the program Andy Young, who spoke here last night. Did you all get to hear Andy Young speak last night? Well, you did, but I didn't, because I was over at the Way, a church in Memphis here, doing a very inspirational church service where I shared a little bit of my story, and so I did not get the opportunity to be here with Ambassador Young and you all last night. And it's a little tricky following in the program somebody of his caliber, somebody of his spirit, somebody who is a potently dynamic and inspirational speaker. And from what I'm told, the real challenge for me today is not only do I follow him to the program, but from what I've been told is that last night he took my best jokes. Now what am I supposed to do? I heard, by the way, Scott, that it was a great sort of Andy Young unplugged session. Thanks to your sitting down and facilitating with him since he had a bad knee. I think you all sat down and had a conversation. I wish I had been here, but thank you for leading that and for having him and for having me as well. So I'm in a little bit of a tricky situation because I've given a lot of talks over the years, but this is the first time I've been back to a city so quickly after I spoke last time, and then following somebody like Andy Young on the program is something that I suppose I once used to aspire to be like, but I'm more realistic in my older age now, and I really am finding it a little bit challenging not only to speak to you after lunch, but to have followed such an esteemed, inspired, spiritual man on the program. And so what else is there for me to do except to jump right in right now by sharing with you, as part of the call to action I'm going to give you at the end of this presentation, by sharing with you my personal perspective. A few of you have heard this personal perspective before. What happened to me on the morning of October the 12th of 1994. And this is from the prologue of my first book, Broken. And I think it will qualify me, at least in your eyes, as to what I'm doing up at the podium here today. There was a sharp rap on the door, followed by a muffled but unmistakable command from a voice outside in the hallway. We want the white guy, just the white guy. We know he's in there. He comes out now, and there's no trouble for anyone later. I was the white guy, and I knew in that instant that my family's desperate search to track me down had ended at this decayed two-story apartment in a violent pocket of Atlanta's inner city. Terrified, I rushed around the room, trying to warn the other crackheads to sit still and keep quiet. Don't panic, I whispered. They'll go away. But nobody was listening because everybody was as high and as scared as I was. We bumped into one another as we tried to find a way out, but there was nowhere to go, nowhere to hide. We were like wild animals trapped by a wind-whipped forest fire. Who was out there banging on the door? Was it my father, my mother, my wife? My mind flashed back to that morning 4 days earlier, October the 8th of 1994, when I had left my house in suburban Atlanta. I remembered kissing 4-month-old Thomas and 2-year-old Henry goodbye. It was a Sunday afternoon after church, and I told my wife that I needed to run some errands before dinner. I drove to the corner of Boulevard and Ponce de Leon Avenues, approached a drug dealer with a thick scar running from his left ear down to the corner of his mouth, and paid him $100 for 6 marble-sized rocks of crack cocaine. I held them in my hands and thought, these will keep me going for a day or two. They were gone in 4 hours. Now the knocking became a relentless pounding that shook the doorframe. I thought about escaping out the back porch to the vacant lot and just running. But where could I go? Where could I go? They would find me, just like they had found me in Harlem and in St. Paul. I'd been running for 5 years, and now I had run out of options. And so on the morning of October the 12th of 1994, in a full-blown relapse from my incurable chronic disease of addiction to alcohol and other drugs, on the morning of October the 12th of 1994, after 2 treatments at Hazelden in 1989 and 1991, followed by 3 continuous years of abstinence. I don't say recovery, because we know that addiction is a disease of the mind, the body, and the spirit. And if those of us who have this chronic disease don't manage our minds, our bodies, and our spirits, like any other chronic disease, it tends to come back. And so there I was in a full-blown relapse after 3 years of a continuous remission from my chronic disease of addiction to alcohol and other drugs, in a crack house in Atlanta, Georgia, in a place that was bereft of any hope, of any sense of normalcy or decency or respect. There I was with all the other crackheads who were no different than I was, except for two things, which I'll tell you about in a minute. But there I was in a full-blown relapse, and the progressive nature of this illness is such that we always get worse. We never get better if we have it and go back to using. And so what do you think I did? With somebody banging on the door and everybody scurrying around the room, there I am, out of options. So what do you think I did on the morning of October the 12th of 1994? I got high one more time. What an illness it is that when help is on the other side of that door, when the gig is up, addicts and alcoholics like me can, in those moments of not knowing what to do, default to the only thing we know what to do: get high one more time. But I become so chronic in my alcoholism and so chronic in my disease of addiction to drugs. A drug is a drug is a drug. I become so chronic that not even the drugs were working anymore. And so I took that last hit of crack cocaine, and up I went and down I came, because no longer could I push back from the truth that was staring me right in the face, that was right in front of me. And the truth was what? I was about to die. Up I went, down I came. And then this is what happened to me in that last moment. I folded my arms over my chest, longing for comfort and for peace. I was so sick and tired of it all. And in that moment, I realized the hopelessness of my situation. And in a sudden, brief flash of clarity, I asked myself this question: now what? I stared at the filthy wood floor littered with half-empty beer cans, cigarette butts, and used syringes. The answer to that simple question, now what? The answer wasn't here anymore. It was all over. I was done. And so up off the floor of that crack house I came on the morning of October the 12th of 1994. Now, I've had a lot of time since then to think about that day. This isn't the first time I've read this prologue in the book, and so I have a lot of opportunity to think about it. But being here with Dr. Moyers and with Butch and Brad Martin and Mary and so many others, being here with people of faith, I'm reminded that in those moments of my chronic disease, in that moment where I had been literally flattened by a power greater than myself, there was only one other power that was greater than the disease that was trying to kill me that could save me. What was that power? It was the God of my understanding. How else can I explain that I got up off the floor of that crack house and I walked past all those other hopeless and helpless souls who were no different than I was, except for two things. One was the fact that the color of their skin was something that was different than mine. Darn it. And the other difference between me and all those other people in that crack house was that unlike them, I was going to get one more chance. I wouldn't want to stand up here today and tell you that God said, oh, well, William, it's your turn to get another chance. I don't believe that the God of my understanding picks favorites, because I was no more or less worthy than any of those other people in that crack house that day. So I won't go there in terms of exploring, and I explore it all the time. What is it about my faith that is the same and different than other people's perspectives, particularly as it relates to health? Why is it that some people get cancer and get well and some people get cancer and die? Why is it that some people with diabetes or hypertension or asthma are selected, or are they selected to get it by a power greater than themselves? I don't believe that. And a long time ago, I stopped saying, why, God, did you pick me? Because I don't think God picked me that day. It just was my opportunity. I don't know. We could talk about that for the rest of this conference, I'm sure. But I got one more chance, and there's no doubt in my mind that I was lifted up off of that floor and out to that door that was banging because of a power greater than me and a power greater than the disease, as I said, that was about to kill me. And I went over to that door, and I opened that door, and there on the other side of that door were two deputy sheriffs from the Fulton County Sheriff's Department who'd been sent there not necessarily to arrest me, but had been sent there as part of an intervention to save me from myself, to save me from a disease of alcoholism and drug addiction. They took me, one in each arm, and guided me out to a van that was parked in front of this crack house, parked there for me. And this is what happened in that last moment. A hard, steady rain was falling as we approached the gray van parked on the curb. The sliding door opened, and I collapsed into the back seat. My father was sitting in the front passenger seat. Turning around to look at me, he saw a 35-year-old crack addict who hadn't shaved, showered, or eaten for 4 days. A man who had walked out on his wife and 2 young children and ditched his promising journalism career at CNN. A broken shell of a man, a pale shadow of the human being that he had raised to be honest, loving, and responsible. His firstborn son. Silence. You're angry, I said. It wasn't funny back then. You're angry, I said. I didn't know what else to say. That's hardly the word for it, my father replied, his voice harsh and cold like the rain outside. More silence. There's nothing more I can do for you, my father said. I'm finished. All these years later, I wrote this memoir in 2004, 2005. All these years later, my father tells me that's where the conversation ended in the van that day. But whether I imagined it or not, and I'm here to tell you today that I did not imagine what my father said to me next, he said it. But I gave my father the benefit of the doubt in this memoir. Whether I imagined it or not, I heard my father say something else to me that morning of October the 12th of 1994. My father said, I hate you. And I remember looking into my father's eyes and speaking my deepest truth, I hate me too. The power of addiction. The power of addiction. When it can cause a father to think that he hates his oldest son. The power of addiction. When it can cause a son, a human being, to think that he hates himself just as much. Is there any question to any of you in here, whether you work in the front lines, down in the trenches, is there any question in your mind at all now that addiction is a disease that is cunning and baffling and powerful? There's no question in my mind. And in fact, I'm reminded of it every day with all the addicts and the alcoholics I work with all over the country and around the world. Because it is a disease that causes rational people to do irrational things. loving people to do hateful things, moral people to act immorally, good people to be bad. The power of addiction. For me, it started innocently when I was 15 years old. I smoked marijuana. I did what a lot of teenagers did in the mid-70s, in the 60s. Yes, a lot of us did inhale. I smoked marijuana not because I smoked marijuana because that's what everybody seemed to be doing. But you know what happened when I smoked marijuana for the first time in 1975, 76? It did something to me that it doesn't do to the rest of the population that smokes it, or at least 90% of the rest of the population. 1 in 10 of us in America, at least, 1 in 10 of us are addicts and alcoholics. Now, in your practices, I'm sure you see much more, higher percentages than that, but roughly 1 in 10 Americans directly have addiction. You know why they have addiction? For the same reason that I have it. For one thing, they voluntarily, willfully ingested a substance into their body. Nobody made me smoke marijuana. Nobody makes us drink or take drugs. We just do, for whatever reason, or for no reason. And I smoked marijuana for the first time, but unlike 90% of the rest of the population, I have two other dynamics that are going on inside of this body here. Some of you have heard me speak about it before. One is that I have a brain that processes mood and mind-altering substances differently. There's a genetic predisposition. I have alcoholism in my family. We didn't talk about it back then. You know, it's a quiet thing to talk about. We'll talk about shame and stigma later. But I have a brain. It was genetically passed on. That does not absolve me of responsibility, by the way. But what it does is that when I smoke marijuana or drink legal alcohol legally at the age of 18 in 1977, it turns on a light switch in my brain which I cannot turn off of my own free will. Again, that does not absolve me of responsibility. Like anybody else who has a chronic disease, I have to be a willing participant, not in the problem, but in the solution. You can't make a diabetic take her insulin. And if she doesn't take her insulin, she's likely to incur diabetic shock or some sort of consequences, amputation or whatever. You can't make a hypertensive follow a program of recovery. If they follow it, they have a pretty good chance of recovering from their heart disease. If they don't, they relapse with it. So I got a brain that doesn't absolve me of responsibility, but helps to explain why I cannot stop using of my own free will. So that's something that I think is very important for you who practice down in the communities of faith all across the country and around the world to understand that when your patients or your clients or your families come to you, it's not a question of just saying no. If it was, it would be easy to stop and start and stop and start. I've quit 1,000 times. But it's this brain that's wired in ways that the National Institute of Drug Abuse are starting to explain to us. Researchers are making great strides. Addiction is a disease with its origins in the brain. There's no doubt about that. My parents didn't aspire to raise their oldest son to become an addict any more than I said, I think one day I'll go to college and learn to become an addict, an alcoholic. No. I've got a brain that just is that way. It's too complicated to explain. Dr. Moyers can probably do it better than I can or somebody else. But the fact of the matter is, I got it. When I do this, turns it on. I can't turn it off of my own free will. But addiction is much more than just a disease with origins in the brain. It is a spiritual disease as well. It's a spiritual disease as well. Because not only do I have a brain that processes substances differently, I have what I call a hole in my soul. Mine is right here. It's underneath my rib cage. And it aches with a sense of imperfection. It aches with a sense that I'm not good enough, that I need to be better than. The big book of Alcoholics Anonymous describes us as being people who are restless, irritable, and discontent in our own skins. I'm not saying that's just unique to the dynamic of alcoholism. Maybe a lot of us are restless, irritable, and discontent, especially these nurses. Yeah, I see you raising your hand. That's good. But in all candor, when you got this and you got a hole in the soul that aches with a sense of imperfection and you voluntarily smoke marijuana or voluntarily drink a cold beer at the age of 18, you know what happens? It turns this on and it soothes this. Suddenly, I don't have to try so hard anymore. I don't have to try so hard anymore to be better than I am. Do you know how difficult it is to be perfect in the body of a human being? It's impossible. And yet so many addicts and alcoholics who can relate to what I am, so many of the people that you're going to encounter, if you haven't already, in your churches, where alcoholism and drug dependence are rife among the congregants. So many of us find we have this irritability, this restlessness, this discontent, and we try as hard as we can to be better than we are until one day we don't have to try so hard because we've found the solution. We medicate the hole in the soul. And part of that medication of the hole in the soul is what I believe pushes us away from a power greater than ourselves, God or Yahweh or whatever you want to call it. Look no further than my life to understand the powerfulness, the powerful grip of addiction and the soul sickness that it is than for me to tell you this. I lacked for nothing growing up. I'm not your typical addict and alcoholic as you might encounter because I lacked for nothing. I lacked for nothing emotionally. Oh, I had some emotional issues, we all do, but I was a pretty well-rounded young guy from a wholesome family. In fact, my parents are about to mark their 60th wedding anniversary. I don't come from a broken home. I'm educated. I lacked for nothing emotionally. I lacked for nothing morally. My parents taught me the difference between right and wrong, good and bad, love and hate. I got all that stuff growing up. Emotionally, morally, I lacked for nothing financially. I come from a family of means. You know what? Addiction is an illness that is a soul sickness. But people of faith can have it. People of faith are as susceptible to this illness. In fact, some would argue perhaps more so because of the preconceived notions of a God of their understanding. People of faith are as susceptible to this illness as those who are agnostic or atheists or believe in whatever else they believe in. It's true. You want to know the proof of that? Emotionally, morally, financially, I lacked for nothing. I lacked for nothing spiritually when I was growing up. Some of you may know my father, the journalist Bill Moyers. He's won 50 Emmys, 2 or 3 Pulitzer Prizes. He's pretty good at what he does at PBS and CBS. So you may know him as the journalist Bill Moyers. Some of you might know. In fact, I met with Joe came up to me before. I don't know where Joe went, but he came up to me before to say that he knew some people and knew my father from way back when. Before my father was a journalist, he was Lyndon Johnson's chief of staff and press secretary. You might know that. A few really old-timers, and I won't look at anybody specifically when I say this, a few really old-timers may know that my father, before he was Lyndon Johnson's press secretary and chief of staff, my father helped to set up the Peace Corps under John Kennedy in 1961, okay? And a few really old-timers, or people who like to go to Wikipedia every day, a few really old-timers might know that before my father was a journalist and before my father was a public servant in the Johnson administration and the Kennedy administration, my father in 1959, when I was born in Fort Worth, Texas, my father was an ordained Southern Baptist minister. My father was in seminary at Southwestern Theological Seminary. In fact, I met a couple last night at the church who were there at the same time that my father was. My father was in seminary in 1959 when I was born. And so I grew up with a fundamental understanding of a power greater than myself. I was never godless until I was 12 years old. And when I was 12 years old, I won't get into it now because we've got to watch the clock here, but in this chapter of my book called The Death of Faith, my faith died on July the 18th of 1971 when I was in a national forest in Red River, New Mexico. I was about 12 or 13 years old then. I was in a national forest. A national forest is a place where there are lots of trees, right? And there were about 10 million trees in this forest. And that day, July the 18th of 1971, I watched lightning strike the top of one of those 10 million trees, peel the bark off of this tall tree, just like a barber pole, hit the ground, and kill a family that was standing underneath it. Yep. And on that day, July the 18th of 71, my faith died as I understood God. I never could understand why. If God was so powerful, He didn't stop that storm from blowing over that forest and killing that family while I was standing there. I couldn't match up the two. So I have a brain, I have a hole in the soul, I have a lot of assets. After the age of 12, I'm struggling with my concept of God. In fact, I'm not even sure I believe in God. I want to believe, but I'm struggling with that. You take this, you take all the trappings of a good family, and you take a disconnection between that and this. You smoke a little bit of marijuana, you drink, and you know what? You end up in a crack house on October the 12th of 1994. Yeah. I've been clean and sober, one day at a time, since that morning of October the 12th of 1994, because I got one more chance. One more chance that included a community-based solution to my chronic illness and to my hard head. I would not be here today. I would not be here at this conference. I would not know any of you if it hadn't been for my family, my employer, my church, my doctor, a few dedicated nurses, my neighbors, and my insurance company. I would not be here today without the collective resources of my community. A community that did not give up on William, even though William had given up on himself. I owe my opportunity to be here today to the fact that I got one more chance. I got to go to treatment in Atlanta, and my community, notwithstanding my father's moment of "I hate you," my community stood by me and loved me even while they hated my illness. I would not be here today either. I'd been to treatment several times. Hazelden in 1989 at the age of 30 out of a crack house in Harlem. Hazelden a second time in 1991 after a crack house in St. Paul. But I wouldn't be here without those resources and without the opportunity to go to treatment again. Why? So people say, well, William, what was it? Okay, so you had your community, you got another chance, whether it was God-inspired or just you won the lottery, you got another chance. What was it, William? Well, it was I got one more chance. I had all the tools. You had given me those tools in earlier treatments. But I hadn't learned how to use those tools yet until I got to that point where I could not answer the question, now what? Treatment, there is no cure for addiction any more than there's a cure for other chronic illnesses yet. There is no cure for addiction, but there is a solution, and that solution is community, and that solution is higher power, and that solution is personal responsibility. I had all the gifts, blessings, luck right in front of me. But only on that morning of October the 12th of 1994, when the gig was up and when I could not answer the now what, only then did it finally happen for me. In the epigraph of my memoir, Broken, the reason why it's called Broken is this. And this is what happened to me that morning. This is all those community assets and that love and that. All of that was right in front of me that day. But it couldn't reach me until I became broken. A disciple asks the Rebbe, why does Torah tell us to place these words upon your hearts? Why does it not tell us to place these holy words in our hearts? The Rebbe answers, well, it is because as we are, our hearts are closed. And when our hearts are closed, we cannot place the holy words in our hearts. So we place these holy words on top of our hearts. And there the words stay until one day the heart breaks and the words fall in. The words fell in. And I got it. I've been in remission. I've been clean and sober. I've been in full recovery, mind, body, and spirit, since that morning of October the 12th of 1994. I believe that coincidence is God's way of remaining anonymous. How else can I explain everything else that's happened to me since that day? Since that day that I got one more chance, that I got help one more time. Since that morning that the heart broke and all of those words, those gifts, those assets fell in. One of the most remarkable coincidences that happened to me in the aftermath of my sobriety of October 12th of 94 was that 2 years later, 1996, I stumbled upon a classified ad in my local newspaper in Minneapolis, St. Paul. And in that newspaper, in that classified ad, it said, wanted, public policy specialist, Hazelden Foundation. I had no career aspirations to ever work in a not-for-profit addiction treatment field. But when I opened that newspaper that day in my house in St. Paul, Minnesota, where I'd moved back to after I had gotten sober in Atlanta, because God told me to. That's another story. There's the classified ad that says, help wanted public policy Hazelden's Foundation, and it was as if somebody had thrown a pie in my face. It was that obvious. It was that obvious. It's like, oh yeah. Coincidence is God's way of remaining anonymous. Because I got the job. I got the job at Hazelden. And on my first day on the job, February the 29th, it was a leap day, February the 29th of 1996, my very first day on the job at Hazelden, my boss, who was the CEO, he said, William, I want you to go out and I want you to change public policy around addiction, treatment, and recovery. You guys are laughing because you know where I'm going with this one. And he said, William, I want you to go out and I want you to change public perception that mostly sees this problem of addiction as one of weak moral fiber or a lack of religion or bad upbringing or happening to be people in the hood on the other side of the tracks. That's the perception about addiction about addiction, is that it's somebody else's problem. A public perception that says, oh, it's a moral failing and it only affects people of some colors or uneducated people. So my boss said, go out and change public policy, William. Go out and change public perception. Go out and change public policy that says that law and order, a war on drugs, is the only way to address addiction. A war on drugs that is nothing more than a war against good people who are sick with a bad problem. He said, go out and change public policy around federal funding for addiction treatment providers. Go out and change public policy that allows insurance companies to discriminate against addicts and alcoholics and their families. Go out and change public perception around the reality of what we know at Hazelden, that addiction is the number one health problem in this country and probably any other country that's represented here today. Now, it may manifest itself in broken homes, violence, chronic disease in other forms, but the bottom line that we believe at Hazelden is that addiction is the number one health problem. It is the root cause of most of what ails us when we come to you. Whether we come to you through the church center, or as a nurse practitioner, or a hospital, or church, most of the time there is an issue of alcohol and other drugs in the problems that people are showing up with, or in the problem that's exacerbating it. And so my CEO said, William, go out and change public perception and help the public to understand what's the root cause of so many problems in many countries, alcohol and other drugs. And not just alcohol and other drugs, he said, change public perception around mental illness as well. And while you're doing it, William, go to medical schools and nursing schools and schools of social work and convince the administrations that they need to do better training around with their nurses and their doctors and their social workers with about addiction issues. Go do that while you're at it, William. Go out, William, he said, go out, William, and eliminate the stigma of addiction by getting rid of the shadow that cloaks addicts and alcoholics and their families in private shame and hopelessness and despair. Think about it. How often do we talk about addiction in our communities? Except there's one that has a hopeless problem. So, William, go out into the communities in Memphis and in Salt Lake City and Oklahoma City and Hartford, Connecticut, and stir up the conversation. Go out and eliminate the stigma, William, the myth that treatment doesn't work. Go out and eliminate the stigma that recovery is not possible. William, go out and eliminate the stigma that is the most formidable barrier preventing people from asking for help, or worse, from getting the help that they need and deserve. Go out, William, and change the terms of the debate for the sake of those who still suffer, he said. And finally, he sent me out the door. He said, William, we want you to go out and we want you to help people understand that addiction and mental illness do not discriminate, and neither should recovery. So he told me to go do that, and I said, sure. Where's the money? Money talks. And the problem was that I work for a not-for-profit. Now, we're a healthy not-for-profit. We've been around since 1949, treating addicts and alcoholics and helping their families. We're based in Minnesota. We have facilities in Florida and Oregon and New York City and a youth facility in suburban Minneapolis and Chicago. We're good at what we do. We're a publisher. We have an accredited master's program. You can get your Master of Arts and Addiction Studies at Hazelden. We're good at what we do. We're big. We're $160 million a year not-for-profit. But we don't have that kind of money to go out and change public policy and change public perception, especially when the other side, insurance companies, alcohol industry, and others have spent 10 times or 20 times what we could spend, or 50 times what we could spend. So I said, where's the money? And he said, well, we really don't have it. I said, no problem. I said, where are the troops? I said, okay, we don't have the money. We'll do it from the bottom up. Where are all the followers? You know, Winston Churchill said, the scariest thing about being a leader is looking over your shoulder and seeing that nobody is following. Mary, it wasn't funny back then either. The shame and the stigma around this illness are so great that when people like me get better, we become invisible. Do I look like an addict and an alcoholic? No. That's the point. When people like me get well, whether we're from the hood, or from a corner office on Park Avenue, or from a medical school, or a soccer mom, when we get well, we tend to look normal, and we behave. And you wouldn't know unless I told you, or unless I had been introduced. You wouldn't have known that I'm an addict and an alcoholic. Why? Because I'm sober. I'm recovering. And so many of us get well, and we're glad to be well, but we just want to melt back into the community and just go about the rest of our lives. And so we had no money to change public policy, and we had no troops to change public perception. No wonder the public thinks that treatment doesn't work, because all they ever see are those who don't make it. Think about it. I haven't broken the law. Well, I got a speeding ticket a couple of years ago, but other than that, in the 19 years that I've been sober, I have not broken the law. I'm an engaged father. I'm a taxpayer. I'm a voter. None of those things would be true if I wasn't recovering from my chronic disease of addiction to alcohol and other drugs. And a lot of us just like to say, we're done with that now. I'm going to get on with the rest of my life. So we had no money and we had no troops. And one day I was speaking at a Rotary club. That's also a chapter in this book. It was a formative moment for me. I was speaking at a Rotary meeting in St. Paul, my hometown now. Speaking at a Rotary meeting, and I had this well-prepared speech like this. It was really clean. And it was about the toll of alcoholism in America. And I was reading this speech, and unlike you all, most of the audience was falling asleep. Untreated alcoholism costs $168 billion a year, and I saw people going like this, you know. Because you know what? That's a drum that we bang for too long. The problem, the problem, the problem, the problem, the problem. We're never banging the drum about the solution. It's always the problem. And as I was reading this well-crafted speech as a public policy specialist for the Hazelden Foundation, and the audience was just either trying to escape out the side doors there or going to sleep. They didn't have PDFs and those things back then, but they were doodling and doing things. I realized I was losing them. And so I took my speech and I put it down and I said, actually, let me tell you one thing. I said, my name is William Moyers and I'm a recovering addict and alcoholic. And everybody froze. They had never heard that before from somebody who looked like me. And that's when I realized, if I'm going to change public policy, if I'm going to change public perception in this country or any other country, I'm going to do it by standing up and speaking out. In Rotary meetings, nursing schools, seminaries, churches, on Oprah, on Larry King, universities, and this conference. Every time I stand up and I speak out, I say, my name is William Moyers, full name. I am in recovery. This is what an addict and an alcoholic looks like. I tell my story to change public policy, to change public perception, to smash the stigma and shift us from focusing on the problem in Memphis or in Atlanta or in Dallas or in Sacramento, focusing a shift away from the problem and towards the solution. That's what my life's vocation is all about. Helping to change public perception, helping to change public policy, helping people get help. Because I am public, because I stand up in conferences, and because I do media, and because my address is listed in the phone book, and my email address is on the Hazelden website, and because I write a column and I write books and so on, I am as publicly identifiable an alcoholic as there is in the country. But unlike all those who live in Hollywood, I'm accessible because I'm just another guy. I'm just another guy. And so I get thousands of phone calls and letters and emails and Facebook messages and text messages and people even coming up to my front door in St. Paul, knocking and saying, William, can you help me? Why? Because I'm public. Because I stand up and I speak out about an illness that is continuing to be cloaked in shame, stigma, and bad public policy. I wrote this book last year. It's called Now What? It's kind of based on that question. I want to tell you, if you haven't experienced it yet with your patients or your clients or your parishioners or your pastors or your rabbis, if you haven't experienced this yet, you are going to experience the now what question in your community-based programs. You're going to have people coming to you saying, my son, he just can't stop taking my pain meds. Or my wife, she drinks too much. Or my dear elderly mother who just lost her husband after 50 years, she seems to be sort of out of it by 5 o'clock every afternoon, and I don't know what to do. Now what? I wrote this book to help move people from the problem to the solution. But you got to help me. You got to help the church center, church health center. You got to help your organizations with all the people who are asking this question every day. One of them is this mother. I got this letter in 2010. It's what sort of, I said, I should write a book about this now. Dear Mr. Moyers, help, my son is dying. I read your book, Broken. It says to hate this disease, not the person, but so help me God. I hate him more than I love him right now. She went on to describe 3 pages of insanity in her family. And she concluded with this: I am begging you, if there is any way my son can be helped, please help me to find it. Please help Scott to save himself. Mr. Moyers, you are my last hope. That's why I wrote the book, to give people hope. But I can't do it by myself, good heavens. That's why I'm here. I think that's why, Scott, you invited me to come here. I'm a small niche of the long continuum of healthcare that you all are delivering. But I'm an important part of that continuum. Because if you don't address substance abuse, substance misuse, then everything else you're addressing isn't going to get any better. You're messengers, angels, nurses of hope. And I need your help. Because I can only help so many people. I need faith community nurses. I need pastors and rabbis. I need doctors. I need doctors' wives. I need not-for-profit heads. I need directors. I need everybody here to help people answer the now what in your community, in your circle, your sphere of influence. You have tremendous influence where you worship, where you work, and where you live. You have tremendous influence in helping people answer the now what. It is a reality, and you can say that's somebody else's issue to deal with, but the fact of the matter is that everybody in here is going to be a catalyst for the healthcare reform that's here and being now implemented. And it is vitally important that you all understand the implications of healthcare implementation on what you do in your community. And if you pull that down a little bit deeper or a little bit to the bottom line as it relates to my perspective, not only do you need to understand healthcare implementation, but you must, I plead with you, you must understand healthcare implementation in the context of addiction. Because it's in the basic benefit package. It's there. But it isn't going to make a darn bit of difference if you all are not advocates for those who still suffer with my illness and for families like mine. People who still suffer in private shame, public indifference, and intolerant public policy. And so Hazelden calls on all of you to take your energy, your expertise, your faith, take them all and help to change the terms of the debate for the sake of those who still suffer. By the way, we're almost done. Hotel bill there. Great. Well, I don't know what I've done with it now, but in your program, Dr. Moyers talked, I got it right here. I actually tore it out. Don't take it from me. You see this page in your programs? Don't look at it right now because I'm going to read it to you. This is what Dr. Moyers says. Where is Dr. Moyers? There he is, back in the back, making sure you don't leave early. Dr. Moyers writes this: I am convinced that the Affordable Care Act will have many unintended consequences. One of those is that it offers a powerful stimulus for faith communities to become aggressively involved in health and health ministries. Prevention and caring for people in non-medical settings is clearly the future of medicine. Who is better suited? Who is better suited to do this work than those of us gathered here? Those are not my words. Those are Dr. Morris's words. And if anybody knows about community-based, faith-oriented, grounded health care in this country, it is Scott Morris and the Church Health Center. Thank you for what you're doing, Dr. Morris, and thanks to the Health Center. So those are his words from his expertise, not mine. But in this subtext is the importance to you, and I say this because I'm biased. I can do that. That you must come to grips with the illness that grips too many of the people you serve: alcoholism and drug dependence. I'm going to close in just a second with a story that I wasn't going to tell, but I can't help but get away from it because I've been dealing with this every day since it happened in February. And because I think it's appropriate for this group of caring people. I speak all over the country, as I said, lots of venues, lots of places. Out on this promotion of this book, I've been at places like, Sioux Falls, South Dakota. Did you hear what she said? She went, yay! Are you from there? Your mother-in-law lives there. Well, that doesn't count. My mother-in-law lives in hell. No, I'm sorry. I'm sorry. She's on her way up. She's being redeemed, my mother-in-law. She's on her way up. Sorry, that just came out of my mouth. I had to say it because your mother-in-law lives in Sioux Falls. You live on the West Coast. You got it made. Anyway, I've been in Sioux Falls. I was with a big healthcare company there doing exactly this work. They didn't think they really had the problem there, but they knew something was going on in the emergency room. that was much more than just broken legs and the result of knife fights. It was called alcoholism and drug dependence. So I've been in Sioux Falls, and I've been at the National Press Club in Washington a couple of weeks ago. And I was at the 92nd Street Y in New York City, which is a place where think leaders gather. And on some of these tours in Washington, D.C. and in New York City, I've had my parents along with me because they wrote the foreword to this book. Why shouldn't they? They're the parents. They face the same now what question that I faced and that so many people face. Addiction is not just an illness that affects the person who has it, it affects the whole family. So my parents, being well-versed and in recovery themselves from their son's addiction, they've been out doing a couple of gigs with me. And we were doing an event at the 92nd Street Y in New York City, which is a big deal. There were 500 or 600, 700 people there, sold out. And we decided to take questions and answers, not at the end, as we're supposed to do today, though we're going to run over here, so I don't think we're going to get much of that. But I decided to, because I love to engage audiences while it's happening, I decided to take Q&A during the course of the presentation. It was a moderator, Susan Cheever, Bill Moyers, Judith Moyers, and me. And so we took Q&A during it, and we did it on these note cards. And so somebody collected note cards while we were doing our thing, and the note cards were passed up to the moderator, Susan Cheever, and Susan had this big stack of note cards, and she took the very first one out of the middle of the pack, okay? Here's the coincidence again, isn't it? She pulled out this one, the very first one from the middle of the pack. She looked at it, and I was kind of watching her, and she got a strange look on her face. So she passed it to the person she figured could answer it better, and Bill Moyers, right? He looked at it, and he passed it to the next person down, which was my mother, Judith Moyers, who is the self-proclaimed fixer. Others would call it codependency. My mother calls it fixer. And she looked at it, and she passed it to the next person in line, who was the last person in the line, who was who? No, the guy from Hazelden, me. And this is what the question said. And I looked at the question. We were on a big stage, hundreds and hundreds of people, and the lights were real bright like that, except that they were so bright that you couldn't really see the audience like I can see you all. You could just sort of see the silhouettes or the shapes. And I looked at it, I had 1 second. This is what the question says. What do you do if you don't want to live? What do you do if you don't want to live? I had 1 second to answer the question. Way too short of a time for my brain to process it. It had to come from, and all I said was, I couldn't see the guy out there. I said, turn to the person next to you and ask for help. What else could I say? I knew that room was filled with people who either were professionals who work in the field, or medical experts, nurses, or recovering people, or recovering families. The room was filled with it, so I figured whoever was writing this down and saying, what do you do if you don't want to live? The best thing they could do was to ask for help by turning to the person on either side of them in this very crowded auditorium. But I didn't see that happen because I couldn't see it, and it was such a stunning moment. I mean, I get it all the time, but never like that. Turn to the person next to you and ask for help. After the evening was over, I learned that the person who had written this question had gotten up and bolted from the audience, the auditorium, before I could answer it. So that person wasn't even there. But somehow, so I don't know, I know, it was another one of those. A nurse who was in the audience knew this person, or somehow got this person's name and phone number and wrote it down on the program, and it made its way up to me after the event was over, and there was this man's name and his phone number. And so I went back to my hotel in New York City that night. It was February, and late February, and I called him. And in a city of 10 million people, he answered. Yeah. And I learned his story. He was a suicide survivor. He jumped out of a 6-story building and survived. Yeah. He was addicted to pain medication and alcohol. He was young and had been through several treatments before. He was at the end of his rope to write the question, but not to wait for the answer. I got him on the phone, I talked to him, and yesterday or last night when I got back to the hotel here from the way, I shot him a little email and I said, "How you doing?" And he said, "William, today I have 37 days of sobriety." Yeah. Every one of you in here is a change agent for people who are suffering from some ailment, but not just a physical or a medical condition. My hunch is that because I know what this conference is all about, I know what the center is all about, that you're also catalysts or bridges between those who struggle with their faith and need to find a faith to get well. That's an awesome responsibility. People are going to ask you this question, if they don't already, all the time. And when they do, because you're here, you'll be there for them as well. I close by telling you this story. Many years ago when I was in treatment, our morning group meditation always included somebody reading aloud a long passage from a chapter buried deep in the back of the big book of Alcoholics Anonymous. The chapter is unofficially called "Acceptance is the Answer." I can still hear those words in the back of my mind, and acceptance is the answer to all of my problems today. In those early days of trying to understand what my newfound sobriety was all about, whenever I read that passage, I assumed that its only relevance to me was in the importance of embracing my reality, accepting that I was an alcoholic and a drug addict. But all these years later, this morning in the hotel room when I was doing my meditations, every day and all these years later, I have discovered an even deeper meaning in the rest of that passage, which has more to do with my life today than I could have ever imagined. The rest of that passage in the big book of Alcoholics Anonymous says this: "For years I was sure that the worst thing that could happen to a nice guy like me was that I would turn out to be an alcoholic. Today I find that it is the best thing that ever happened to me. The best thing that ever happened to me because I moved beyond believing in God. Remember, I had the belief down until it died in the lightning storm. And then I'm at my now what moment in October of 1994, and I can't answer the question, now what? And in that moment, I found God again. I found God again, not the God of my understanding from the old days. Because in the old days, I believed in God. But on the morning of October the 12th, and as it relates to that passage in the big book, and as it relates to the coincidences that allow me to be with you today, what I found for me is that to move from the problem to the solution to this day right now, to where I can help people and you can help them too, was not so much about believing in God for this alcoholic and addict. It was about trusting in God. Trusting that God could do for me what I cannot do for myself. That's exactly the position you're in as well. Not just as people of faith, but as nurses and doctors and leaders who can take your expertise in the medical field and your faith, put them together and help move people from believing to trusting. Trusting in God and trusting in your expertise. I'm reminded of this every day in my work, in the faces and in the voices and the stories of people like me and families like mine. When I hear the stories of, what do I do when I don't want to live? When I hear the stories of, dear Mr. Moyers, help me save Scott, my son is dying. When I hear those stories, I'm reminded of mine. In their brokenness, I see the depths of my own despair so many years ago. And then I realize, thank God, I realize the distances that I've traveled and how far there is still to go. We got a long way to go. But I go there with each and every one of you today. Thank you very much. Thanks. Thanks, Mary. Thanks. Thank you. I have no idea what time it is. I went over. I apologize for that. But if we have any time, what time is it? We got 10 minutes. I'd love to take a little Q&A, and if you need to go ahead and leave. But if you'd like to take 5 or 10 minutes before I sign some books, I'll take some Q&A from people or some criticisms or comments. I'll repeat the question. Anybody got one? There's a door prize for the one who asks the first question. You get it. It's a box lunch. How do you help somebody without being the enabler? That is a beautiful question. Go ahead. Yes. Right. Yep. Yes. Yeah. Yeah. You don't turn your, would you turn your back on anybody who was sick with any illness? No. So you should not turn your back on somebody who is sick with the disease of addiction. That does not mean you enable them by giving them $10 for bus fare or allowing them to be in your house or maybe even to come to church drunk, although I would argue that maybe that is probably a good thing. I don't know. But here's my point. There's a man who lives in, Scott and I know him, Mary knows him, a lot of us know him. He's a man who lives here in Memphis who's a great supporter of the Church Health Center and other causes. And in this book, he's got 4 steps to sanity. I don't identify him by name. It's on page 64 of the book. It's his 4 steps to sanity because he's been dealing with an adult child who continues to be in and out, in and out. And what the message of what he writes about in here is that you help somebody by keeping the lines of communication open. You let them know that there's help out there in your community. Where are you from? Florida. There's lots. Naples is where our program is. So you can say to your parishioner Mary, there is treatment available if you would like to get help at Hazelden or lots of other places. By the way, I'll be in Jacksonville next week speaking. But there's lots of treatment around. And there's lots of AA around, and there's all that stuff that can be facilitating it. But Mary, parishioner Mary, you've got to be willing to be part of the solution here. I can't help you with the problem anymore, Mary, but I can help you with the solution. Keep the line of communication open. How frequently? As often as you interact with that person. That doesn't mean if you have the alcoholic or the addict living in your own home or even living in your own church that you tolerate that kind of behavior. No. You set boundaries, but you must continue to keep the hand open. My father, he hated me in that instant, but he was there. He was there, as was the rest of my community, including my pastor and a nurse or two and those kinds of things. It's a tough one. You don't allow people to break the law. You don't allow the person you don't enable the person by letting them continue to break the law in your house or in your church by bringing in illegal drugs or disrupting the service, or vomiting on the floor over and over again. But you don't close the door either. But you always say there's always hope. And you try to steer them towards the solution. At the end of the day, it takes personal responsibility. A lot of people don't make it with this illness. which is another myth, by the way, that I try to break in this book. A lot of times people say, well, they got to hit bottom first. Because there's only one bottom with this illness. It's death. And anything short of that is a way out. Keep the line of communication open. Know where the resources are in your community. Hate the illness. Love the person who has it. Yeah. Other questions? Yes. War on drugs. The war on drugs has been a failure for 225 years in this country. Okay? Why? Because it always seeks to eliminate the supply without also equally trying to eliminate the demand. 80% of the federal drug budget in this country goes to interdiction and tough law enforcement, raiding meth labs in Florida, spraying coca fields with poison in Colombia, jailing 2.2 million Americans, most of them of colors other than mine, most of whom are there because of a drug or alcohol problem. The war on drugs is an abysmal failure, and if taxpayers who are fueling that war on drugs understood the utter futility of their tax dollars at work, they would stand up and speak out. Okay? The war on drugs is a failure because it focuses too much on the problem and not on the solution. I will tell you this, though. I am adamantly opposed to the legalization of any more substances in this country. Why? Because this country has never been able to get its arms around the most used and abused drug in America that's legal. It's called alcohol. I'm not a prohibitionist. I'm not a member of the temperance movement. No. Most people use alcohol responsibly. But it's those who don't use it responsibly who cause untold havoc in our churches and in our highways and in our families. I don't think legalizing marijuana, you know, that recreational drug, is the answer any more than the war on drugs is the answer. What is the answer is prevention, treatment, community-based services, and most important, the continuum that happens after somebody goes and gets treatment and gets into recovery. You got to manage the illness. I've been in remission from it for 19 years, but I still have it. And I got to go to my meetings and connect up there and work with the we of the program that's so important and do all those other things. The war on drugs is, I was in Colorado, in Aurora, of all places where the shooting was, back in February, and it's like the Wild West out there because they have just voted to legalize marijuana under an ounce. And people are immigrating to that state in droves. It's unbelievable. Does that mean all of them are going to become addicted? No. But just think of how many people are going to be driving under the influence of marijuana now. So I'm opposed to the war on drugs. I think we need to shift the war on drugs to one that is a war against a disease that treats people who have it here in Memphis and elsewhere. Where are you from, by the way? So you know what I'm talking about. Yep. Well, yeah, you know, I'd love to enroll all of you. You know, the Winston Churchill analogy I used. We do have a movement now in this country. I helped to start it back in the 90s. It's called facesandvoicesofrecovery.org. Facesandvoicesofrecovery.org. We're going to be actually premiering a movie in Washington on April the 25th called The Anonymous People. And then we're going to premiere it in St. Paul. I'd love to see a premiere at the Church Health Center here in Memphis someday. And this is about standing up and speaking out. And I'd love to get all of you to be agents for change in this war on drugs. It would be great. www.facesandvoicesofrecovery.org. It's a not-for-profit. We started in the 90s. It's doing really, really well now. So, because you know Dr. King was not just a dreamer, he was a doer. And you know, it's really easy for me to get up in front of a podium and dream with you guys all I want to. I got tired of that a long time ago. Yeah, I can inspire audiences wherever I go. That's not what it's about for me anymore. It's about change. It's about change. I mean, Obama cites change. I mean, candidates are always talking about change. And then nothing changes. But I've seen change. Dr. King was a change agent. This lecture series is named for a change agent. You all are change agents. And so I'd love to see us all get involved in our respective communities about changing the world on drugs. Any other questions before we close? Yes? Yes, unprecedented. I hate to say it's not unprecedented. No, I went to Washington Lee in Lexington, Virginia. I went from there from 1977 to 1981. It's a long time ago. I became alcoholic. I think I crossed the great divide between alcohol abuse and alcoholism about the time I was 20. I mean, because I could drink legally. And there was a culture of alcohol on my college campus in the late 70s. The other day in St. Paul, I met with a young man who just graduated from my alma mater 2 years ago. He's 24 years old. He went through treatment at Hazelden. He's been sober for 2 years. He said that the culture of alcoholism at Washington, or the culture of alcohol at WNL, is as prevalent now as it was back then. It hasn't changed. We're more aware of it. We're more aware of it. By the way, this is not to promote it, but Hazelden has actually recognized this as well. And we actually have a new tool on our website, the name of which I'm forgetting right now. But it's a tool that colleges and universities can use to address alcohol abuse on campuses. You can find it at www.hazelden, hazelden.org. That's our website. So it's around. I mean, it's no different. It's no different, I hate to tell you. The only good news in it is that there are a lot of student health services now on campuses that are beginning to really recognize that you can't just discipline a student who drinks too much and keeps drinking too much and keeps drinking too much. You got to get them help. Any others before we go? One more. One more. Yes. Yes. I think I understand what you're saying. So your family has been touched by alcoholism, or? Yeah. Oh, how much should we talk about it? We better talk about it, because if we don't, who is? The internet? Madison Avenue? Advertising? I mean, all the time, listen, I know we got to close this out. If we don't, there's a genetic predisposition. My parents never talked to me about it. We talked about the war in Vietnam. We talked about sex, drugs, and rock. We talked about sex and rock and roll. We talked about Watergate. We never talked about alcoholism in my family, even though we had, not only did we have alcoholism, but my uncle lost his life as a result of addiction to pain medication in 1967. I was always told he had cancer. My parents didn't think they needed to talk to me about it because they didn't think we had a problem. My children are the product of two alcoholics, me and their mother. My children are 10 to 16 to 25 times more likely to become addicted than their classmates in college or in high school. Why? Because of the genetic predisposition. I owe it to my kids to talk to them, not in the gritty detail necessarily, but to talk to them about my alcoholism in the same way I talk to them about my recovery, because I got to arm them with the facts. I hope my children never experiment, but one of them already is, and is already sort of bumping up against the rules in college that make me worry. So you know what? The best part about talking about my story is for them is that I lead by example, not just in terms of that abyss into the problem, but redemption into the solution. So we've got to talk to them. We've got to talk to our children in the same way we talk to them about anything else. Thank you for giving me the opportunity to talk with you today.
Okay, we're officially in a break till about 2 o'clock. William's going to be out at the table out there signing copies of his books. And be sure to check the signs outside the doors. I know Stacy said there was a couple of room changes that were going on at the intensive that started too. Thank you.